about why you cannot fall asleep and why it feels like melatonin is not working. So you might have been in bed for hours on end where you're tossing and turning. And this is not happening just one occasional night. This is happening multiple nights in a row, maybe a couple of times a week or even more. You might have had this issue for weeks or months or years or decades, like some of the patients that I see. Here's what I want you to know. You do not have a melatonin deficiency. You have what we call a hyperarousal problem. Your body and your brain is in fight flight mode all the time. And there's an association that has developed between your bed and a state of wakefulness. And we're going to break that all down now. Now, if you don't know me, I'm Dr. Funke.afolabrown. I'm the founder of the Restful Sleep Place. And here's our mission: to help you restore good, healthy sleep so you can be the best version of yourself. If you have not subscribed to this channel, you want to hit that subscribe button right now. Now, let's talk about what's going on. Let's talk about the physiology of insomnia, which is what you're struggling with when you are having all these struggles sleeping. The issue is that there are few things that control our sleep, right? There is what we call our sleep drive. This is that propensity and likelihood for you to fall asleep the longer you've been awake. There's also a balance between your sleep drive being high and your arousal system being low. This is what makes for beautiful sleep. When at night you're sleepy, you've been moving around, you've been active during the day, and you're tired naturally, and also your body and your brain is able to relax, that's when you're able to sleep. So why is your brain not shutting down? Now, this may have been something that happened in the past. Maybe you had an event, right? A life-changing event. Now, because of that event, whether it was good, bad, ugly, neutral, whatever, you were not able to sleep. Maybe the first night, the second night, the third night. Now it's been a week. Now you start to anticipate that you're not going to sleep. Now you actually start to feel anxious as bedtime approaches. I've had people say, I have anxiety as I start to brush my teeth. What has happened is you've now developed what we call a conditioned arousal. This is when you get into bed and it's like the light switch literally turns on. When you're sitting down, maybe in the living room, and you're watching TV with your family, you're relaxed. You might actually be nodding off, but you get into bed and it's like, okay, we're not sleeping right now. We're absolutely not sleeping. And so what has happened is exactly what we call a conditioned arousal. This does not have to do with melatonin at this point. This is really not about taking melatonin, because in fact, if you take melatonin and you take it for the wrong reason or at the wrong time, you might actually make your sleep issues worse. This may not necessarily have to do with relaxation to put yourself to sleep, because the issue with relaxation is, what's the goal? If you're doing relaxation to knock yourself out, it might not work, and you might develop anxiety around it, because now you're going to say, well, I relax and I'm still not able to sleep. And now you get into what we call sleep-related anxiety. So that's not going to work. Another thing that's not going to work is just not some random sleep supplement. There's such a big industry of sleep supplements now that it's insane. It's literally insane. And again, you start to lose confidence in your ability to fall asleep, and you put your confidence on those sleep supplements. And what I see over and over again, I've done this for over a decade, is people start to say, well, the supplement didn't work, so I doubled the dose, or I tried a different one. And so it's not about supplements. And it is absolutely not about going to bed earlier, because I've had people say, well, let me get into bed soon so that maybe I'll have a chance to sleep. And what you're doing is you're going to make that sleep drive weaker. So it's not about going to bed earlier, right? So what is the issue? The issue here is a few things. There's your circadian rhythm that might be getting disrupted, especially if you're a woman in midlife. There might be caffeine or other things that might still be in your system. This can make you feel agitated. It might potentially be. There might be evening light exposure if you're on your phone or you're watching TV, and, not just any type of screens, but, especially those that are very close to you. All those things can be agitating enough and can contribute to that increased, tired but wired feeling. It might actually also be unrecognized thoughts, racing thoughts, and anxiety. I have a lot of of patients who say, well, I'm not really anxious. I'm not an anxious person. But sometimes some of those thoughts are actually there and they're lingering and they're lurking. And sometimes, again, the thoughts you might have when you get into bed and you cannot sleep is, it may not necessarily be anxious thoughts. It may just be repetitive thoughts. I've had people say, I just have a song that's just playing. It's like playing a loop in my mind and I can't seem to shake it. So we've talked about what it's not. We've talked about what sleep onset insomnia can be due to. Now let's talk about treatment that actually works. There's a concept called cognitive behavioral therapy for insomnia, or CBTI. This is the validated evidence-based treatment for addressing insomnia in women, in men, in children. Of course, we need to adapt it. This is a strategy. These are a series of strategies that actually work and help you rediscover your sleep confidence. So I'm going to share a few of the basics with you here. Now, number one is what we call stimulus control. So remember what we talked about, right? You get into bed. Your brain now wakes up. You're now tossing and turning and tossing and turning for hours. Your brain has learned to associate the bed as where you wake up and where you're scared and where you're worried and where you're frustrated. We want the bed to be associated with sleep. We want you to see the bed and say, the bed, that's where we sleep. So what we practice is what we call stimulus control. And really the basics of this is really about getting out of bed when you cannot fall asleep. There is no point staying in bed, tossing, turning, only for you not to be able to sleep again. It's retraining your brain. So when your brain is awake and it's like, I'm not going to sleep, I cannot sleep, I don't feel safe, you're saying, well, that's not a wakefulness promoting activity. We're going to get out of bed. Usually some people will say, well, maybe about 20 minutes. I don't want you watching the time. So usually we'll say, if you start to feel frustrated or it feels like it's been a while, get out of bed, find something to do that's calming and relaxing. And as soon as you start to feel sleepy again, because sleep will always come back, then you get into bed. This is so key because you're going to again start to weaken the association of the bed with wakefulness and you strengthen the association of the bed with sleep. The second that I oftentimes share with a lot of our patients is what we call sleep restriction. This is not something I enjoy using the term. I prefer to call it bedtime restriction. So it's really limiting the amount of time that you're spending in bed. Now, this makes no sense. It is literally counterintuitive because now you're saying, Dr. Brown, I said I'm tired, I'm exhausted, I want to sleep. You're saying, don't sleep? Like, don't do that to me. And I know, yes, it sounds like that. It sounds counterintuitive. But again, it is strengthening that association further. And this is a game changer when it comes to being able to sleep well. Now, another thing that you might want to consider, this is really around what we call the cognitive shuffle. This is a technique that really helps with racing thoughts. This is a technique that can help with calming that mind. And it is super powerful. It's really around recognizing the thoughts that are not sleep promoting and replacing them with thoughts that are sleep promoting. And you might do a little bit of what we call cognitive distraction. So I'll just share like maybe two that I do with our patients. And also we have an insomnia program because there's a whole host of techniques that we can use. Sometimes it's finding a word. Maybe you'll find one word like with 5 letters, maybe stand. And then every letter of that word, you use it to now make up other words. Again, it's really just kind of focusing on other things instead of that feeling of frustration. So for instance, stand. So you could look for 5 words that start with S, seat, C, schedule, like things like that. T, you look for teacher, table, so you're constantly just kind of working around moving those racing thoughts more towards something that's less intense and less frustrating. This is something that works, again, not in isolation with all of the other elements of cognitive behavioral therapy for insomnia. So this issue of sleep onset insomnia works very, very responsibly, responds really, really well to structured behavioral treatment. but you do need the right protocol. You do need the right sequence. It's not just pulling stuff out of the hat. We're literally not making this stuff up. This is stuff that is structured. This is a programs. These are programs that are structured for you. Now you can do CBTI with as part of a treatment with a board certified doctor or a therapist who's certified in CBTI. You could read books. But guess what? We just created a comprehensive insomnia course that literally walks you through all you need to do, what you need to do step by step with prompts and questions using an evidence-based approach. I use this for all my concierge patients in my practice, and we get amazing results. And I am so excited to share this course with you. This is something that you can get access to on our website. If you go to the restfulsleepplace.com/courses, you'll find a link there. You'll need to create an account, and voila, you can start to walk this journey. And if you're someone who maybe you've tried courses, you're frustrated, it's not working, well, come visit us at the Restful Sleep Place, where we'll be able to hold your hand and walk you through this program in a comprehensive manner to help you to get to the root cause of your sleep issues and help you to find the lasting solutions you need. So I hope this has been helpful. Absolutely help me get the word out. Share this video. Tag somebody that you feel would benefit from it. Tell others about this work, because you help us to help so many more people. And until next time, I hope you rest well.